I am Dr. Sangeetha, fertility specialist, laparoscopic surgeon, and into cosmetic gynecology with 20 years of experience practicing at Coral Advanced Fertility, New Bell Road, Bangalore. For a couple to conceive naturally, that is, for natural conception, there are certain prerequisites which we have to know before we can advise them for natural conception. In a female, most of the tests, like after completing your history and examinations, if everything is normal and there are no significant points added, we have to check her overall health, including the basic hemoglobin, diabetic status, thyroid profile, lipid profile, the functional tests of liver and kidneys, and serology tests, like we have to rule out any sexually transmitted diseases like HIV, HBsAg, HCV or VDRL. And then coming to the ovarian reserve, the specific tests which we want are like a basic baseline ultrasound, which we prefer a transvaginal scan compared to an abdominal pelvic scan. And in the scan, we specifically look for the normal anatomy of the uterus and the endometrial thickness during different periods of menstruation, and we track the ovulation from second day until ovulation and formation of corpus luteum. Along with that, few hormonal tests like anti-Mullerian hormone AMH or the day 2 FSH, LH and estradiol levels add on to the test wherein we can tell the ovarian reserve the quality and quantity of oocytes a female will have. Along with that, we will have to check her infection, examine the genitalia, and we have to rule out any other psychological issues. And we have to tell them the safe period and the fertile period in a naturally normal cyclic female. But in a female with irregular cycles, we might have to help them with ovulation induction. Coming to the functional tests in a male who are planning for conceiving naturally, along with their history and examination, and everything is fine, we have to check their semen analysis, like the minimum required for a male who are like pursuing to conceive, like we want their sperm count to be more than 15 million per ml. We want the motility level with sperm motility, with rapid progressive motility and progressive motility to be more than 50%, and normal sperms to be more than 4% according to this strict criteria. In the same test, we just try to find out if there is any infection in the semen. We see the pus cells, we see other factors, and then we treat accordingly. And again, in a male also, other associated disorders, whether it is psychological, whether it's medical like diabetes, thyroid, hypertension, and any occupational problems, everything has to be dealt with before we come to a conclusion. Yes, this couple can try naturally, and we can advise them everything about natural conception. Couple trying to conceive, and when we advise them natural conception is possible when all other tests are normal, then we just examine them and advise them regarding the fertile period, and if there are no other problems during the sexual intercourse, they can definitely try and go for natural conception. Of course, we help with counseling, we help with their diet, and we specifically ask for weight reduction. If they are on the higher side, we have to check their body mass index, that is their weight according to their heights. And again, we have to advise them specific diet for each and every couple based on their diet, based on their condition, because it can be different for a normal person to a person with PCO, or to a person with diabetes, or to a person with hypertension or any other medical conditions will ask for different dietary changes. So we should have a specific nutritionist or dietitian who can advise specifically for this couple. And personally, I advise them to go for a good nutritious diet, complete balanced food, and to decrease the intake of carbohydrates and direct sugars, and increase the amount of proteins and good fats. And they have to add nuts, especially walnuts and almonds. They have to add more of pulses, greens, vegetables and seeds, in their diet, and especially eggs are also very good for fertility conception. And when we come to supplements from our side, definitely we'll have to go and give them the folic acid supplement for the female, and the vitamin D3 and calcium levels has to be within normal levels. After checking the levels, if they are found to have a diminished vitamin D3 levels in their blood, we'll have to supplement with vitamin D3, because given the condition, nobody wants to be in the sun, and there is very less sun exposure, and hence very less vitamin D3 is produced by the body. And folic acid and vitamin D3 are have to be supplemented. Along with, we have to improve the quality of eggs and sperms. We'll give them a dose of minerals, antioxidants and other vitamins to ensure that the quality of gametes are good before they go in for conception. And it is especially important in certain couple with some conditions. And what they can expect, like even after trying for 1 year without any protection, that is unprotected intercourse, if they don't conceive, they have to go for counseling and go in for all the checks. And once everything is fine, they zero in on natural conception, and they should be made aware of whether they're ovulating or not. And once everything is fine, they have to go in for fertile period or timed intercourse, along with ovulation induction or without induction. And with all these supplements, definitely they can have a healthy baby and healthy pregnancy. Couple who are going in for natural conception, they have to take care of their health, a nutritious diet and lifestyle modifications. Simple modifications, like they have to reduce their stress levels, they have to be happy in life, they have to consume a very good nutritious diet on time, and they have to go in for simple regular exercise, and they have to spend more time with their partners. Basically, they have to reduce their stress, consume good nutritious diet, along with any other reduction in the risk factors surrounding them.